Thank you all. I'd like to take an opportunity to thank USC for inviting us today to talk about this rather large and complex area of healthcare policy. And as you've heard from other speakers talking about environmental policy or education policy, please know that we're focusing on policy, but it is incredibly complex and has many subcomponents, including good data collection and problem defining, good management, good education, and good political will. So with that, I'd like to start today by asking Arsen Torosyan, thank you so much for joining us. I'd like to ask you to, just for a couple of minutes, talk about the state of healthcare in Armenia today.
Hello. Of course, as you told, healthcare is a very complex area, and 3 or 4 minutes is not enough to make an understanding of what we have now in Armenia. But just to give a short description for the audience. So we have a Soviet model healthcare system, reformed but not to the end point as we could wish. So we have stuck in something in between of Soviet model and Western model healthcare. Some figures that may give light on what we are doing in Armenia. We are spending 1.3% on healthcare as a public spending, which is the worst. We are worse than in the world, let's say so. Because sometimes it's not fully understood that when we say why healthcare is so poor in Armenia, we should also always remember these figures. Plus, we spend 85% out of pocket. Why I'm saying these figures, because when I tell what are we going to do with this, it's very important to know the current situation. We have healthcare system that has very low level of primary care visits, twice less than European averages. This is very important to understand how we develop the preventive medicine rather than the curative medicine. We have very high levels of cardiovascular diseases, cancer, diabetes, lung diseases as a main cause of mortality. But we also have very good things that, for instance, the decreasing levels of child and health mortality with the current health spending, which is far good than the comparable countries. We have pretty good child and mother mortality, yes. We have pretty good hospital system, mainly located in Yerevan. We are investing a lot in electronic systems. Now we are expanding the like electronic health records, you call them in US, which will help us in decision making, data collection, and further evidence-based decisions. Okay. That's it, very short.
Well, we're going to get into that more. I'm going to continue with asking questions about some of the areas you raised. In public health, we talk about a country's burden of disease. And that means trying to learn about what are the primary causes of death and illness in a country. And recently there was a report that came out that Dr. Shekherdimian described to us in a conference that we had last weekend in New Jersey. Can you talk a little bit more about the idea of the burden of disease in Armenia?
Sure. So what was interesting about the report that had come out just a couple of weeks ago and that we discussed at the conference is the impact of 4 conditions on the healthcare system and the health of the entire country of Armenia, namely cardiovascular disease, cancer, diabetes, and respiratory disease. So these are the non-communicable diseases. Non-communicable diseases in general are the cause of 93% of mortality in Armenia. The economic burden of just these 4 conditions is is unimaginable. So over 350 billion Armenian dirham economic burden of just 4 conditions. 22% of Armenians will suffer a premature death before 70 years of age, because of these 4 very conditions. And the question then becomes, if I may take the opportunity to actually ask a question to the minister, is how do we develop policy to address these major killers and the morbidity and mortality caused by these conditions? And what are the challenges with developing the policies to address these issues in Armenia?
Thank you, Dr. Shekherdimian. As you told, yes, recently we've learned that NCD burden on the Armenian economy is 350 billion AMDs. It's immensely big number. It's about 6.5% of our GDP. So it's very important to understand that when we speak about combating non-communicable diseases, it's just not for the health of the population. It's for the health of the economy of Armenia. First of all, as I told, we have very, I would say, poor primary health care, preventive medicine, because the main way to combat these diseases is to prevent them. To prevent them and to control them, not to make them on the deeper stages when we can't either save lives or we have to spend lots of money to keep patients alive. And one of our main directions is to develop the primary healthcare system of Armenia, when we can control these diseases on the level of outpatient visits in rural areas, in urban areas. Investing not only financially to the primary healthcare, but also making some reforms. As I told when I start speaking, the primary healthcare system is also a Soviet type in Armenia. We have reformed the rural part of it, which is now like a family practitioner-based system, which works more or less good. But in urban areas, we have polyclinics that have internists plus pediatricians plus neurospecialists. And I think that this system is insufficient now. We are trying to figure out which is the best model for urban areas to reform it, to invest some performance-based payment systems that doctors are interested in having more healthy patients than more referred to hospital system. The second area is to introduce public health programs to prevent these diseases, like for the cardiovascular diseases, cancer and respiratory diseases, to combat risk factors of these diseases, namely the smoking, but plus going to diabetes, the sugar control programs for the white goods of people, programs for healthy food, starting from taxation and ending with health education. But as you asked, what are the challenges to introduce these systems? Yes, the challenges are a variety of challenges, starting from the understanding of problems and communicating them to the other officials, because we can't do it alone, let's say so. Everything should be passed to the government, to the parliament, and ending with limited resources to do these reforms, both financial and human resources, because money is not enough to do the reforms. We need these capacities, intellectual capacities, which sometimes lack in certain areas, and we try to get advices from international organizations, from diaspora professionals like you. and but we are hopeful that we can face these challenges and tackle them.
So,
Thanks. I was going to just follow up by saying that, in public health, we think about disease in terms of understanding the risk factors that underlie the disease, and behavioral risk factors are easily identifiable statistically for being associated with, again, this idea of burden of disease. So if we state at the start that the main or primary causes of death and premature death in Armenia, and of course disability leading prior to death, are cardiovascular disease, cancer, diabetes, and a few others, pulmonary diseases, then of course we have these main risk factors that we can think about. So many of you would know that smoking in Armenia is more highly prevalent than it is here. I won't ask for a show of hands of how many smokers we have here, but Baron Torosyan, in the United States, there's a long history of tobacco control. It's not easy, it takes a long time, but we know that this is one of the priorities of your ministry. Can you talk a little bit about some of the latest initiatives that your ministry has taken in your efforts to reduce smoking and in essence, reduce this burden of disease?
Thank you. Yeah, you are correct that we have 4 main risk factors for these 4 main non-communicable diseases: smoking, diet, physical activity, and what are the 4th? Diet, physical activity. Anyway, okay, let's jump to smoking.
Let's just focus on smoking for the moment, and I have the list, so I can get back and remind you what it is.
As a California being a champion in anti-smoking campaigns worldwide, we are trying to follow the path that countries have passed by combating the smoking. Actually, we are champions too back in early 2000s when we have the law of tobacco control, first law of tobacco control, that bans smoking in some public areas, bans tobacco advertising, some marketing tools. But it's not enough for now because we have 52% adult male smoking population, which is again one of the worst in the world, not only in the region. We are again in the top 10, worst 10 worldwide. And as you know, as we may know, the tobacco kills every second smoker, every second. And we are losing more than 1,000 just male smokers yearly from lung cancer. Not even counting other diseases like the same heart attacks, ischemic strokes, etc. And to go further with these tobacco control initiatives, we are now drafting a new law which will introduce further bans on smoking in all public enclosed areas, all of them. Restaurants, cafes, with no exceptions, let's say so. Plus, we'll expand restrictions on marketing, tobacco marketing, because our experience showed that tobacco companies use these loopholes in the laws when we ban advertising, but they use other like display of cigarettes as a way of advertising. So we will ban the display of tobacco products in points of sales, on kiosks, etc. Plus, we will have some regulations on how the tobacco will be sold in points of sales. We will have a small raise on tobacco taxes, very small, which I'm not satisfied, but we have this situation just for your information. Plus, we are going to work with Ministry of Education to introduce this healthy lifestyle classes into the public schools, public schools programs, which is again not good so far. So these initiatives are very unpopular now in Armenia. Just for your information.
What's unpopular? The smoking initiative is unpopular?
Yeah, anti-smoking initiatives. We are criticized for them. We are criticized for them sometimes. The main criticism is that why you are trying to do the unimportant things, just make healthcare services more accessible, cheaper, etc. But we as health professionals know that we have to more prevent diseases than cure them, and we will see the results of these initiatives in 5, 10, even 20 years from now. But we have to do it now, to start now, and not let for others to do. We have to leave the cleaner country for our children, cleaner, safer, and healthier.
Thank you. That's a good segue. Yeah. I want to see if I can interrupt you just for a minute and ask Shant to talk about, so now we've mentioned that smoking is very highly prevalent in Armenia, and that we know that it's leading to death and disability and premature death in particular, and that you're trying to do things, but the support of the population is not always there. I think for those of you who are familiar with the culture in Armenia, there is not a focus on prevention in general. Shant, last weekend you mentioned some other risk factors that account for a significant amount of the burden of disease in Armenia. Can you talk a little bit about what you read and the difficulty of expecting people to partake in behaviors that would prevent their illness from getting severe?
Right, so the risk factors, not surprisingly, are topped off by smoking and tobacco use, but exercise or the lack thereof, alcohol use, increased salt intake, and then some behavioral issues such as adherence to medications. The same study that we had talked about reported that 80% of patients who were prescribed in Armenia, who were prescribed hypertension or high blood pressure medications, that are supposed to be taken on a daily basis, 80% of the people had not taken it over the 24 hours prior to the survey. And so designing the policies and then implementation of these policies and implementation of the behavioral changes that are necessary to make these effective are yet another layer of complexity that we have to deal with. But it's also an opportunity, and I'd like to use this as a segue to maybe switch gears here and talk about us in the diaspora, for us to be involved in healthcare and health systems strengthening in Armenia, and to think about health system strengthening in a way that's different from how we've thought about it over the past couple of decades. So I think today we've sort of dissected out and we've learned from the minister about the major problems in healthcare. And to me, when I hear this, what is clear to me is that these problems are not ones where the solution is for us to continue doing what we have done in the past, sending of supplies, building of hospitals, us in the diaspora, or going in to do short-term clinical activities. But that's easy to say, but harder to ask the following question, which is, well, what is the role of the diaspora? And how can we contribute to this new set of problems from the diaspora? I see this as an opportunity. I see this as an ability for us to engage in health system strengthening in a way that we haven't done so before, to leverage people that are outside of healthcare, the sociologists, the people who have expertise in other sectors that can contribute to the initiatives that are necessary to address these risk factors. But I'd like to use this as an opportunity to ask the minister about his thoughts and his ideas about the role of the diaspora and what we can do to help with these initiatives that you have taken upon.
Thank you. Actually, I pretty much agree with you about the support we can get from diaspora. We mainly see short-term clinical missions, plus donations of supplies, medicine, or some donations for reconstruction or renovation of hospitals. Of course, they are important. But during these years, nearly all hospitals in Armenia have already built. So we have left some 2-3 hospitals in the villages in our provinces. Plus, we have, as I told in the beginning, not bad hospital system. So the support I personally and my ministry, like policy-making institution, needs is more of expertise and more of groundwork. So somebody with very good expertise in, let's say, health economics, which I need right now to develop a sound health insurance system in Armenia, comes to my ministry and works with me, bringing the international experience that can be adapted to Armenia. The same can be done also remotely, but sometimes it makes things more complicated than easier. The same with the health professionals. Like, we have a very good example of recent example of introducing a stroke control program in Armenia, which is supported by American and Canadian Armenians, that helped us to develop this program. How can we save patients with acute stroke in Armenia? And they didn't do it by themselves. They don't come to Armenia and treat the patients. But they helped us to write down this program, and we implement it by ourselves. Of course, they help us remotely. They come and monitor the program. But the main thing that diasporan Armenians can be engaged in Armenian system, I see this way.
Thank you.
Anything else to add? Sure.
So
go ahead.
No, I wanted to give a perspective. I actually think, Arsen Torosyan, that your job today is even harder, maybe, than it was in the early 90s when I was in Armenia. I worked on a program to promote optimal infant feeding practices in an effort to reduce infant mortality. And there were people who were stakeholders there that you know. There was the Vice Minister of Maternal Child Health, Vahakan Demircan, and with his deputy, Garine Saribekyan, they worked with the World Health Organization, UNICEF, USAID, and the American University of Armenia, where I was working, to develop a national strategy where they took baseline data, developed a series of interventions. There were only 2 Armenian channels, TV channels at the time, and they could, Haramanov, they could change policies in hospitals for what happened to babies right after they were born. And we were able to do this social marketing. And I think that's one of the positive developments of Armenia, as you mentioned, was the reduction of infant and child mortality at a truly, truly difficult time in Armenia's transition. If you had a magic wand and you could wave that magic wand and have a wish, what are the certain areas or the certain environments that you'd like to see in place for you to be able to make the kind of change that we know that Armenia is capable of?
You mean diaspora support in these areas?
No, I mean, the diaspora should be here, I think, to support whatever the strategic plan is for Armenia. Okay. And it bothers me, and I should say this to the audience, and Shant and I have spoken about this many times, that if smoking is the leading risk factor leading to death and disease in Armenia, why aren't diasporan organizations working on smoking cessation programs, right? So I think it's that kind of a conversation. If you want to stay focused on the diaspora, that's fine too.
No, I can say what we are planning to do in midterm, like 3, 4, 5 years.
Perfect.
3 main directions.
Perfect, that'll be great.
ministry and the general government too in the area of healthcare. So as I told, the first is the development of prevention medicine, shifting from curative medicine to preventive medicine. By developing the primary healthcare, reforming the primary healthcare system, and preventing the diseases by introducing these policies as with tobacco control. The second is to have a sound cancer control program, national cancer control program, which is derived from the first direction, but has particularities, and we consider it as a separate direction. From prevention to early detection to treatment with surgeries, chemotherapies, and radiotherapies, and ending with palliative care when we have to just ease the pain of the patient. And the third main direction, which is again very important, is to provide universal health coverage as much as we can from the beginning for the total population, to avoid catastrophic health expenses that sometimes impoverish our citizens. And if I can get any support on these three areas from anywhere, from diaspora, from international organizations, it will be very helpful. And these three main areas can have very big impact, and financially and on health outcomes on our population in this midterm period, I think.
Thank you very much. Shant, I'm going to hand it to you for final comments.
Yeah, so as our time runs out, I'd like to end on a more optimistic note. So we talked about a lot of startling statistics and some impressive numbers today, but I'm actually the most optimistic that I have been and can be currently when we talk about healthcare in Armenia. I see the new Armenia and the realities that we have as an opportunity to really do amazing things with healthcare in Armenia. And for us not to be an average nation with regards to our GDP or our resources, but to be above average, because we have a resource that no other country does, or very few do, and that's the diaspora. And I think that with effective planning, collaboration, that there is precedence now from around the world of external stakeholders really having made fundamental impacts in the healthcare systems of other countries. And while they may be absent in our Armenian reality, we as a diaspora are present there. And I firmly believe that once we have a good understanding of the fundamental issues and challenges with healthcare, that we now have a ministry, government officials that are extremely excited and receptive to collaborating with us. We have institutions such as the American University of Armenia, and even here the USC Institute of Armenian Studies that has funded some of the research that many of our residents and medical students have done at UCLA that hopefully may be able to benefit the minister with regards to his national cancer strategy, for example. So I really do think that this is an exciting time. I think healthcare is an inclusive field that should not be limited to people that are in the healthcare profession, and certainly not limited to only physicians or nurses. And I believe that we have everything that it takes to make Armenia's healthcare system one of the best in the world. And with that, thank you for the opportunity to speak with us.
Thank you very much, Arsen Torosyan. Thank you. Thank you.